Doctor, I should have come sooner.
I understand. Let's discuss your options.
I was so scared.
We'll face this together.
I've lost count of how many patients have sat across from me with advanced colon cancer, saying the exact same words. Doctor, I noticed something strange in my stool months ago, but I thought it was nothing. I wish I had come in sooner. Right now your body might be screaming a warning at you, and you're flushing the evidence away without even looking. What comes out of your body shows you what's happening inside months, sometimes years before you'll feel sick, before the pain starts, before any blood test will detect it. Today I'm showing you the warning signs you must never ignore, and the one color that means emergency room now. Before we continue, drop a comment and tell me where you're watching from. And if you've ever noticed something concerning in your stool but didn't know what it meant, type yes, so we know how common this is. Here's what most people don't understand. Your stool is literally showing you what's happening with your bile ducts, your liver function, your pancreas health, and whether there's internal bleeding you cannot see or feel. The color, shape, and consistency reveal everything from parasitic infections to inflammatory conditions to cancer. And the deadliest signs are often the most subtle. To help you understand this clearly, doctors use something called the Bristol stool scale. It describes how stool appears, ranging from very hard pellets to completely liquid, numbered 1 through 7. I strongly encourage you to look this up and keep it as a reference. There's no shame in this. It's a medical tool that empowers you to monitor your own health. If your stool looks like type 1, very hard separate little pellets like rabbit droppings that are difficult to pass, that's severe constipation. Your intestine has been holding on to waste too long, and it's drying out inside your colon. This causes pain during bowel movements, hemorrhoids, anal fissures, and significantly increases inflammation throughout your entire body. At the opposite extreme is type 7, completely liquid diarrhea. This means your intestine is moving too rapidly and isn't absorbing nutrients properly. Here's what you need to remember. Ideally, your stool should come out formed but soft, like toothpaste consistency, and brown in color. When food passes from your stomach into your intestine, it mixes with bile that starts out greenish. During digestion, that bile transforms, giving your stool its characteristic brown color. So that familiar brown actually signals normal digestion. Now here's what most doctors don't explain properly. It's not enough for form and color to be normal. Frequency matters just as much. Ideally, you should have a complete bowel movement every single day, preferably around the same time. Some people naturally go every other day, and if that's been your lifelong pattern and you feel completely empty afterward, that can be normal for you. However, when more than 2 or 3 days pass without a bowel movement, or when you notice sudden unexplained changes in your usual pattern, that's a red flag demanding attention. Changes in bowel frequency can signal intestinal blockages, hormonal imbalances like thyroid dysfunction, chronic stress, certain medications, insufficient fiber or water, or problems with your liver or pancreas. Now let's talk about the specific danger signs. Healthy stool should exit with normal thickness, roughly the diameter of a banana. If your stool is coming out thin, narrow, or pencil-like regularly, that can warn that something is partially obstructing or narrowing the passageway in your intestine. This doesn't automatically mean cancer. It could be low fiber, inflammation, or an anal fissure. But it can also indicate a growing tumor. If you notice repeatedly thin pencil-like stools, especially if this is a change from normal, see a doctor promptly. When you go to the bathroom, you should feel complete emptying, that distinct sensation of relief in your lower abdomen. Many people, especially as they age, sit for extended periods because they never feel finished. Another concerning symptom is constant sensation of needing to go throughout the day, even after you've been. This means your intestine hasn't emptied properly or is experiencing inflammation. Now regarding stool color variations, if your stool appears green, this usually isn't alarming. Either your intestine is moving food through quickly, so bile doesn't have time to transform from green to brown, or you've eaten lots of dark leafy greens like spinach or broccoli. However, if your stool appears yellowish, pale, clay-like, or whitish, and this persists for more than 2 or 3 days, it can signal poor fat digestion, parasitic infection, or problems with your pancreas, liver, or bile ducts. Regarding floating versus sinking, for years people believed floating stools indicated serious disease. Modern medical understanding tells us that floating versus sinking by itself isn't significant. Stools float simply because they contain more gas. What really matters are form, consistency, frequency, and any significant changes from what's normal for your body. Now we've arrived at the most critical part. What is the single most dangerous type of stool? The worst-case scenario representing a true medical emergency is when your stool appears very dark, black, with the appearance of tar or coal. This is called melena, and I cannot stress enough how serious this is. This typically indicates significant bleeding in the upper part of your digestive tract, your stomach or small intestine. The blood has been partially digested as it travels through, giving it that characteristic black tarry appearance. What causes this? A bleeding ulcer in your stomach, bleeding from intestinal blood vessels, or in certain cases, hidden cancer bleeding internally. The black tarry appearance tells us the bleeding is substantial. If you ever notice black tarry stools, do not wait. Do not tell yourself you'll call your doctor tomorrow. Go directly to an emergency room immediately. I've seen patients who delayed seeking care for black stools, and by the time they came in, they required transfusions and emergency surgery. Don't let that be you. There's another color warning. Bright red blood. If you notice bright red blood on toilet paper, on the surface of your stool, or mixed throughout, this also demands attention. Bright red blood typically means bleeding from your lower intestine, colon, or rectum. Sometimes this is relatively minor, like hemorrhoids or a small anal fissure. However, bright red blood can also indicate polyps growing in your colon. Polyps start out benign, but some types can transform into cancer over time. Bright red blood can also be a direct sign of colon cancer that's already present. Blood in your stool, regardless of color, should never be dismissed as probably just hemorrhoids. Get it checked properly with a thorough examination and likely a colonoscopy. Now let me give you 3 powerful strategies to protect your intestinal health starting today. Strategy number 1, move your body every single day. If you spend most of your day sitting or lying down, your intestinal system becomes sluggish. Your colon needs movement to function optimally. Simply walking 20 to 30 minutes daily or staying reasonably active makes an enormous difference. Physical activity stimulates the natural contractions of your intestinal muscles that push waste through. Strategy number 2, have at least 1 colonoscopy after you reach age 45. Current recommendations suggest screening at 45, and if you have family history of colon cancer, even earlier. Colorectal cancer is one of the most common and deadly cancers, and it typically grows slowly and silently. You can have a tumor developing for years without symptoms until the cancer is quite advanced. Here's the empowering part. Colorectal cancer is one of the most preventable cancers. Nearly all colon cancers start as small benign growths called polyps. A colonoscopy allows doctors to find and remove these polyps before they ever become cancer. It's literally cancer prevention, not just detection. Yes, the prep is unpleasant. You'll clean out your colon the day before. But that one day of discomfort could literally save your life. Strategy number 3, and this is the most powerful, protect your gut microbiome every single day. Your gut microbiome is an ecosystem of trillions of microorganisms living inside your intestinal tract. When you take care of this ecosystem, it functions like a highly trained army of protectors working 24/7. Let me tell you what these microorganisms do. They help digest food, particularly fibers your own enzymes can't handle. They manufacture essential vitamins, including B vitamins and vitamin K. They strengthen your immune system. About 70% of your immune system resides in your gut. They influence your mood by producing neurotransmitters. They affect your weight, metabolism, inflammation, energy levels, even memory. When your microbiome is healthy and balanced, you feel good. You have energy. Your digestion works smoothly. But when it becomes disrupted, your entire body suffers. You may experience digestive problems, increased infections, worsening chronic diseases, mood disorders, weight gain, brain fog, and fatigue. How do you protect this ecosystem? First, avoid things that damage it. The biggest culprit is inappropriate antibiotic use. Antibiotics are life-saving when truly needed, but they're massively overprescribed. Every time you take antibiotics, you're killing good gut bacteria along with bad bacteria. Only take antibiotics when truly necessary for bacterial infections. Now actively support your gut microbiome by consuming probiotics and prebiotics regularly. Probiotics are live, beneficial bacteria. The best food sources are fermented foods. Plain unsweetened yogurt with live active cultures, kefir, fermented vegetables like sauerkraut and kimchi and kombucha. Include at least 1 serving of fermented foods daily. Prebiotics are equally important. They're the food that feeds your good gut bacteria. Where do you find prebiotics? In simple everyday foods. Less ripe bananas, apples, whole oats, onions, garlic, asparagus, seeds, fruits with their skins, and vegetables. You're not relying on expensive supplements. You're eating real whole foods that feed beneficial bacteria that keep you healthy. Let me bring this together. Taking care of your digestive health isn't just about your intestines. It's about protecting your overall health, quality of life, and potentially your survival. When your digestive system functions well, you feel well. I want you to feel empowered, not frightened. Knowledge is power, and now you have the knowledge to monitor your own health, recognize warning signs early, and take action before small problems become big ones. Start paying attention today. Every time you use the bathroom, take just a moment to observe. Make it a habit. Don't wait until you have a serious problem to start caring about your digestive health. Start now, today, with your very next meal and your very next trip to the bathroom. If this information could save someone's life, share it. Hit that like button and subscribe for more evidence-based health content. Comment below and tell me, did you know about the Bristol stool scale? Have you ever had a colonoscopy? Let's start a conversation about digestive health without the embarrassment. Your health is your most valuable asset, and you have more control over it than you think. Take care, and I'll see you in the next video.